I'm Jerry Way from the ICANN School of Medicine at Mount Sinai. I'm here to interview a long-standing friend and colleague, Dr. Sidney Winawer, who is Emeritus Chief of Gastroenterology at the Memorial Sloan Kettering Cancer Center and currently Chair of the Cancer Prevention Program there. Sidney, tell me about growing up and what happened to you and how you became interested in becoming a doctor.
Oh, Jerry, first let me tell you that's an honor to have you interviewing me. I really appreciate your coming to do this. One day I was living in Brooklyn, the son of immigrants from Poland, and our family doctor walked in, and he examined my sister. She had an earache, and then he lined up everybody else and looked in their throats, examined their ears. And he was so warm, and he was so friendly and so competent. I must have been about 10 years old. I said, I want to be like him. I want to be a doctor.
Good, good.
And so my mother caught on to that. And every time we had company, she gave me a little black bag, and she shoved me into the company, and she said, look, he wants to become a doctor. So I think that kind of instilled that into me, but I really developed a passion for medicine very early on, and as a kid, and then in high school, I developed a passion for it also. And so I went to medical school.
Where'd you go to medical school?
I went to medical school at downstate, and this is very interesting because in my third year in college, I wasn't sure I was going to get into medical school because in those days, it was not so easy for a kid in Brooklyn to get into medical school. And so I applied and got into the University of Geneva, and I got in. And it was during the Korean War, and the draft board called me down and wanted to change my deferment from student to 1A and send me in the infantry to Korea. And there was a doctor on the panel, and I showed him the letter from the University of Geneva. And he said, let him go, we'll get him later. Whew, you know, I was almost in the infantry in Korea. And so I got into medical school and then an internship.
No, where?
Downstate. And then I went, I did all my training in Brooklyn. And then I went into the Air Force. And when I came back out of the Air Force, I went back to Maimonides in Brooklyn. And I came under the influence of a gastroenterologist there. And I liked what he was doing. And so I said I want to be like him. I want to be a gastroenterologist. But he really couldn't train me. He was one guy, and so I wanted to go up to the Mecca in Boston or even across the river to a New York hospital. So I went across the river to Marv Schlesinger, and he told me for an hour how wonderful his program was, and then he said, I don't have a place for you. I'm sorry, but go to Howard Spiro in Yale. Maybe he can take you in. So I went to Howard Spiro. I said, Marv Schlesinger recommended that I see you. So Howard Spiro said, oh, really? Marv Schlesinger, come on up. And so he talked to me for an hour, and then he said, I'm sorry, I'm going on sabbatical. He said, why don't you go see Norm Zamchek up at the Harbor Division of Boston? So I called Norm Zamchek, and I said, Howard Spiro and Marv Schlesinger just said I should see you. He said, oh, those are two great guys, come on up. And I had a wonderful interview, and he said, all I want from people is to roll up their sleeves and work. So I rolled up my sleeves and said, okay, you're in. And so then he became my mentor. And in my GI fellowship up there in Boston, I was exposed to all the greats in GI. I even pushed my way into a journal club. We were at the Harvard division. I pushed my way into a journal club in the Boston University division, and rounds with the Tufts division. And I went to the Boston City Hospital cafeteria every night and sat around those big round tables and listened to the professors talking, and I really loved it.
But I remember reading an article that you wrote on mentoring, and I thought that the article was you being a mentor.
Well, first I was mentored. Later I became a mentor. But my mentor up in Boston was such a special guy. He sat with me at the end of every day and edited my papers.
That was Norm Zamchek.
Norm Zamchek, right, you got it. And he edited my papers, and he talked to me, and he looked in the microscope with me, and I was so taken with him, I said, I want to be like him.
So how'd you end up at Memorial Sloan
So
Kettering?
he was an academic guy. So I wanted to go into academic medicine. So I finished in Boston, and I did very well up there. I had a lead article in the New England Journal of Medicine on massive small bowel
You've had a lot of other lead articles in the New England Journal of Medicine since then.
I know, but that was very important. I was a fellow, and so I did very well, and I was offered jobs all over. You know, those days, gastroenterology was in its infancy, and there were positions all over. Not that many positions, but there was nobody to fill them. So I was offered positions everywhere. I was offered a position in New York, and they wanted me to stay in Boston, but New York had the Metropolitan Opera and my family.
So and your family, right.
So I went into I accepted a position at the Cornell division at Bellevue and Memorial Hospital and New York Hospital, the 3 Cornell divisions. But I got exposed to cancer a lot in Boston because there was a cytologist up there who did gastric washings on pernicious anemia patients and found malignant cells like 20 years before they developed clinical cancer. And so I got very interested in cancer up there. And one of the hospitals in the Cornell circuit being Memorial Hospital, I got very interested in Memorial. It just became an academic full-time hospital, and there was only one GI guy there, Paul Sherlock. He just started the division, and he asked me to join him. I started making rounds there, went to conferences, and so we got very friendly. And he asked me to develop a GI endoscopy unit, which I did. And so that's how I got to Memorial Hospital and really into cancer.
Well, what was the impetus that started you on the road to the National Polyp Study? You've made such an impact on colon cancer, colon screening throughout the entire world. How did you get into that?
Well, Jerry, you know a lot about the National Polyp Study. You helped me organize it, and you were a key investigator in it. Amazing in clinical practice, and still interested in research. You know, those were the days, you know very well those days. Those were the days where colonoscopy was just introduced in the 1970s. But Gene Overholt in the U.S. and Niwa in Japan were very instrumental in introducing that. And then Hiromi Shinya and Bill Wolfe at Beth Israel introduced colonoscopic polypectomy. And so all the GI guys were running around taking polyps out. And nobody knew how to follow these patients. And they were coming, that's right, and they had the patients come back at 6 months, a year, 18 months, 2 years.
I thought 1 year was the golden opportunity to repeat a colonoscopy.
Well, you were conservative. Some guys had the patients coming back at 6 months. So, but I felt that because of the long natural history of colon cancer, from polyps, adenomatous polyps to colon cancer, that was demonstrated over in St. Mark's Hospital by Morrison and other people there. And because of that, I felt that it wasn't necessary to do colonoscopy so frequently.
But how'd you get into the National Polyp Study?
I just came up with this idea of establishing this post-polypectomy model, where we took polyps out and randomized people into a 1 year and 3 years versus a 3 year. And you know very well that it was very difficult to get the investigators to defer the first colonoscopy to 3 years.
It was impossible. I thought it was nuts.
That's right.
A 3-year follow-up? How could you do a 3-year follow-up?
I know, and everybody felt that way. But you were going along with it, and you helped me convince the other guys to go along with it. And we demonstrated that the 3-year follow-up was fine. We didn't have to get the patients back more often, more earlier than that. And then in the National Polyp Study, we demonstrated that we could stratify the patients into low risk and high risk and defer the low risk to 5 years. And now they're being deferred to 5 to 10 years. So it was a very nice piece of study with scientific evidence that not only could we defer the colonoscopy to 3 years, but we also could demonstrate within that framework of that study that colonoscopy was the way to follow patients. And that the barium enema, we had a lot of innovation in that study, as you know. We did a blinded, unblinded technique comparing colonoscopy to barium enema. And Bob Fletcher wrote an editorial when we published that data saying, the end of the barium enema. You remember that?
I sure do.
We killed the barium enema. You know, colonoscopy in those days was challenged. It was not accepted. And even when somebody had a colonoscopy, primary care physicians would order barium enema just to be sure of what the colonoscopy did found.
It was a different era, but you put it on the map on how we should follow colon polyps and what happened to colon polyps over time. And it was all your work. Tell me, how many publications have you had from the National Polyp Study?
Oh, we had a record 5 publications in the New England Journal of Medicine, plus many other publications. But besides the surveillance results in a National Polyp Study, we found a number of other things. And one of the most important findings in a National Polyp Study was that when we removed polyps, we prevented cancer. Now, everybody kind of accepted the idea that colon cancer came from polyps. That went way back to the articles, the studies by Dukes at St. Mark's in the 1920s and 30s. But there was no scientific evidence that indeed that was true. And in the National Polyp Study, we gave the scientific evidence. We proved that if you remove polyps, you prevented cancer. So that resulted in a couple of things. One, I chaired with Bob Fletcher the Guidelines Committee in 1997 of the U.S. Multi-Society Task Force, and we included screening colonoscopy for the first time in the guidelines as a result of the National Polyp Study. The second important outcome of that study is that we proved that the adenomatous polyp should be a target of screening, because if you remove it, you can prevent cancer, obviously. And so the goal of colorectal cancer screening changed from that point. Before, the goal of colorectal cancer screening was early detection of early stage colon cancer for better survival. After the National Polyp Study results, the goal was twofold: early detection and also prevention.
Prevention was the main problem, and how to prevent colon cancer. And you showed the world how we should prevent colon cancer, how we should attack polyps, and that they were the culprit behind colon cancer.
Yes, and so from that point on, all the guidelines included a dual purpose goal for colorectal cancer screening: early detection and prevention. So I think the National Polyp Study was very instrumental in doing that. We also characterized the advanced adenoma as being an important target, and we also demonstrated in a National Polyp Study that the familial risk for colon cancer increased if there was a family history of adenomatous polyps, not only of colon cancer. So the National Polyp Study had a lot of results. The National Polyp Study also became a model for other studies. The blinded, unblinded technique that we used was then used to compare CT colonography and colonoscopy, and also the post-polypectomy model of the National Polyp Study was then used to evaluate the effect of antioxidants on polyp recurrence, aspirin on polyp recurrence, nutritional intervention. So it became a kind of and it's interesting, it's the only randomized controlled trial of surveillance. That now the EPOS trial has just been initiated by Hover in Spain, and to see whether or not the intervals can be further expanded. And I think it's timely. It's the right time to do that kind of study. So you know about the National Polyp Study. You were so heavily involved in it.
But your story about how you first got into the polyp study when you were swimming, tell us about that.
Oh, I forgot about that. Yes. I was actually swimming it was at a GI meeting.
It was a DDW.
It was DDW, although in those days we didn't call it DDW, we called it just the AGA meetings. And it was in Colorado Springs, and I was in the swimming pool, And Kevin Morrissey, the president of ASGE, and Marv Schlesinger, the president of AGA, swam up to me and said, "Sid, we want to do something together, a joint research protocol." And so I just seen the movie The Graduate, where Dustin Hoffman walks up to his father's friend, and the friend says to him, "Plastics," and walks away. And so I said, "Polyps," and I swam away. And 6 months later, Marv Schlesinger calls me, and he said, "Sid, I have a good idea for you. We want you to do a project on polyps." I said, "Oh, that's a good idea, Marv." And so I don't know how I conceived of the National Polyp Study. It was, to this day, I don't know how it was just a light bulb just went
It
up.
was a very complex study, though. You had radiologists, pathologists, gastroenterologists, everybody, and surgeons involved in the National Polyp Study right off. And we had our first meeting. Where did you have your first meeting?
Oh, you remember that first meeting? It was at some dinky hotel in LaGuardia Airport. And John Bond always reminds me that it was a regular room, and in the corner they had a bed that was not made up. But you know, we had all the potential investigators sitting around the table, and we asked each one how many colonoscopies and polypectomies were done in their unit. And they told us. And after that meeting, a few days later, you and I got together and we decided to fire all those investigators because they didn't have enough volume.
Yes.
And so we got a whole new group, and we identified the best endoscopists in the country for the National Polyp Study, and the best radiologists, and also Michael O'Brien, the outstanding pathologist from Boston, who reviewed with two other pathologists every single slide of every single polyp removed. And then, of course, Ann Zorber came aboard. And
Ann was a big plus for the National Polyp Study.
She was terrific, yeah. She was absolutely outstanding. And she was the one who actually was able to set up a system to track the patients by the National Death Index, so that we could report a 20-year follow-up on the patients who had polyps removed, and demonstrate that not only did we prevent cancer, but we prevented deaths from cancer. And that made the front page of the New York Times with our pictures and everything.
Did.
I mean,
it certainly did. I have that copy of the New York Times.
That was very, very exciting.
So tell me, what advice can you give to young doctors that are coming up into the field of gastroenterology?
Well, I guess the same advice I would give to my kids and my grandkids and anybody else. Although I'm really too.
I take it it's going to be roll up your sleeves.
Yeah, roll up your sleeves, right, and work. That's important. Very important. Hard work. But I think when I think about it, it's really maybe two things: passion and persistence. I had a passion for medicine. I wanted to get into medical school. I wanted to go up to Boston, and I really pushed myself. I pushed my passion, and I persisted. And even with the National Polyp Study, you know, the first site visit we had with the National Polyp Study, they rejected it. They couldn't understand that if we took out polyps, you could prevent cancers. They didn't understand that, and they rejected it. But I was able to go to the NCI and get and explain the concept and get another site visit, and they gave us, and they passed us. And then when we went for a renewal, for a 5-year renewal, they rejected it. The site visit team said, "How come you have so few cancers?" They couldn't understand that we were preventing cancers. I had to go to the National Cancer Advisory Board and explain this to them, and so I was able to get it renewed. So I think the persistence, my passion, and also besides the National Polyp Study, I've been, as you know, very involved in screening for colon cancer. Working at Memorial, I've seen such tragic stage 4 colon cancer. Screening is the way to go. And as you know, I've been involved with the guidelines and committees and lectures and talks and all kinds of stuff.
All the guidelines are yours.
I've had a passion for colon cancer screening, and I follow with persistence and very focused. So I think that I would say to have a passion and follow that passion is, I think, so important, because it gives you joy also. It gives you fulfillment. It gave me
Well, Sidney, there's no
fulfillment.
doubt that you made a tremendous impact on not only colon cancer in the United States, but throughout the entire world, and we're all better off for it. Thank you.
Well, before we go, Jerry, I want to tell you one more thing, that it's been a joy working with you. And speaking about joy, I think underlying everything has been a joy of discovery, of discovering our relationship, discovering medicine, GI, national polyps, the joy of discovering relationships with young people, with my kids, grandkids, young fellows, faculty members, patients, the joy of discovering a diagnosis in a patient, because you and I basically were clinicians besides all the research. So I think the joy of discovery, looking through a microscope, my first microscope in medical school, and seeing the tissues and red blood cells, and it's like contemporary art of Miro with a bright red and a bright blue. So all of that joy has, I think, has been underlying my entire life, personal and professional, and the joy of collaborating with you and having your friendship and doing this interview with you is really enormous, and I appreciate it very much.
We all appreciate it. Thank you.